Namaste, I am Dr. Aditi Prabhu, naturopathy and yoga physician, also stress management expert. Today I am here to talk about diabetes mellitus, one of the leading diseases across world. Few years back you might have seen or heard people suffering from diabetes post 50s or post 60s. Nowadays it has increased in younger population as well. Yes, it has become the 7th leading diseases across worldwide. In 2019 survey, 426 million people across the world were suffering from diabetes mellitus, that is around 8.8% of the overall population, and 4.2 million people died because of diabetes mellitus. So what is diabetes mellitus? Diabetes is a group of disorders which is caused by the dysregulation or the dysfunction of hormone insulin, which is secreted by pancreas, which cause increase in the blood sugar levels, are also called hyperglycemia, which is a hallmark of diabetes. Now what are the symptoms of diabetes mellitus? So the major 3 symptoms of diabetes are increased urination, increased thirst and increased appetite. If diabetes is not taken care or managed in early stages, there will be risk factors or complications such as ketoacidosis, polyneuropathy, disorders of the eyes, also in later stages cardiovascular disorders, strokes, kidney diseases, etc. So because it is a group of disorders, there are a number of factors which are included or involved in the cause of diabetes mellitus. So today let us see what are the different types of diabetes mellitus and what is the mechanism underlying diabetes mellitus. So there are 3 types of diabetes mellitus. Type 1 diabetes mellitus, or also known as insulin dependent diabetes mellitus. Type 2, also known as non-insulin dependent diabetes. The third one is miscellaneous. Now before we dive into these types of diabetes, let us see how the hormone insulin works. In response to increase in blood glucose level, the pancreas produces and secretes a hormone known as insulin into the bloodstream. And this insulin acts on the cells throughout the body to remove the glucose from bloodstream, either by taking it up, using it for energy, or store in the form of glycogen. And as a result, the blood glucose reduces. And this decreased blood glucose levels then serve as feedback mechanism to inhibit the insulin production. So there are 2 major steps in the insulin pathway. First, insulin must secrete in response to increase in blood glucose level. Second, the cells throughout the body must respond to the insulin in order to lower the blood glucose. Type 1 diabetes mellitus typically present during childhood and it's caused by genetic predisposition with environmental triggers. The exact trigger is still not known. But combination of these 2 results in autoimmune disorders in which immune cells of immunity attacks beta cells of pancreas to prevent them from producing insulin. Type 2 diabetes mellitus typically not always present during adulthood. And it's even more strongly associated with genetic predisposition. But in type 2 diabetes mellitus, instead of unknown triggers, the genetic predisposition is accompanied by other predisposing conditions such as obesity, hypertension, etc. And the combination of these factors results in inability of the cells throughout the body to respond to insulin. Even though type 1 and 2 are common, there are other important causes of disease, and these includes diabetes caused by medication known as drug-induced diabetes, which are caused by a group of medications. And the other miscellaneous cause of diabetes is diabetes during pregnancy, known as gestational diabetes. Now let us connect all this together and see how this affects the insulin pathway and results in diabetes. In type 1 diabetes, the autoimmune attacks on the beta cells of pancreas and prevent the production and secretion of insulin into the blood. Thus, type 1 diabetes inhibits the first step, since decrease in the production known as insulin deficiency. However, in other two, the pancreas continues to produce insulin, but it's the cells throughout the body that are unable to respond to it. So this mechanism inhibits second step, and this is known as insulin resistance or relative insulin deficiency. So it doesn't matter which type of diabetes mellitus, there will be either insulin deficiency or insulin resistance. So this pathway will not work and the body won't be able to decrease the glucose level. This results in hyperglycemia or increased blood glucose level. So this is the mechanism of diabetes. Thank you.